Hi, Dr. Bill.
Hi, Cheryl. How are you doing?
I'm doing okay. How about yourself?
I'm fine.
Yeah, good. Hopefully this will be a nice short one tonight. We'll see though.
That was a marathon, but with arsenic on the agenda, who knows?
Yeah, it really was. Yeah,
We
that was a
know,
rough
we
one. We
know
haven't.
that that's bad, right? Yeah, I did see your note to the Water Commission. That was very good. I read the response.
Okay.
Yeah.
Hey, Bill.
It worked. It worked. Camera. My wife's wondering why I'm saying that. All right, I'm gonna go get my headset and some paperwork. I'll be back.
Hi, Mike.
Hello, Cheryl. Can you hear me?
I can.
Yeah, I forgot I had a power outage, so I needed to do something with my email server. So I don't think I have the participant link now yet, and I'm glad you promoted me to a panel.
Yeah, you deserve that.
Appreciate it.
So you have your own email server? That's amazing.
Yeah, it's in the basement.
Mike,
You
have to turn off your router and turn it back on.
Well, it's my I've got a Raspberry Pi, so
Oh, okay.
I know how to fix it. I just haven't yet.
All right.
It's when we get a power outage, I need to restart a few services on the power.
Yeah. There must have been quite a widespread one between about 1:30 and 4 in the morning.
Oh, I didn't know that.
Yeah,
Well, it was for us.
we lost power for 4.5 hours
Wow, that was last night?
last night.
Oh,
Yeah, we lost it for about 3.
wow. I don't know if we lost it because I'm on, in West Acton Village, so, we're usually high priority to get reconnected. All the businesses nearby.
What you really want to do is be next to a hospital. They truly do get priority.
That's for sure. They deserve it.
Yep. Or a police station.
They're too noisy.
Or the mayor's house.
All those sirens.
True.
I live right next to the schools. We get it on quicker than anybody.
Really?
Yeah, I think schools would get it too. Are you by Douglas, Tom?
No, I'm by the junior high.
Oh, yeah, because I saw you walking a month and a half ago.
Yeah. Coming from by the junior high.
Ah.
Oh, shoot. I forgot one thing. Had to get my official Apple time standard.
Cheryl, are you still on?
Yeah, she is.
Yeah, I'm here.
Are we correcting minutes tonight?
I submitted the last time we met and the one prior, so I'd like to.
Okay,
You know, I did update the agenda, but it looks like you got the wrong one. So let me just make sure that that's the
Yeah.
one that got posted, the other one.
Yeah, I pulled down the other one from the DocuShare, Cheryl.
Okay, so the other
Oh.
one has both sets of minutes, right?
Yes.
Yeah, okay, just wanted to make sure.
All right. Well, good evening. I have 7:30 p.m. So, and I see we have a quorum of members virtually present. So I will call the meeting to order. Could I ask Cheryl, have we been notified that any of that Joanne in particular is not going to be able to make tonight's meeting?
I was not notified.
Okay. Joanne, you're not on the phone, are you? Okay. Rika, I see you've joined us, Dr. Singh. If Joanne is not able to make tonight's meeting by the time we are calling for a vote, would you please vote in Joanne's place?
Definitely.
Great, thank you. All right, so the first first order of business is for me to read a script from the town of Acton. It says, good evening. It's a little past 7:30. This is an open meeting of the Board of Health being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020. Due to the current state of emergency in the Commonwealth and the local state of emergency declared by the Acton Board of Selectmen and the Board of Health due to the outbreak of the COVID-19 virus. In order to mitigate transmission of the virus, the Board of Selectmen have suspended all public gatherings in accordance with the governor's order. All members of public bodies are allowed and encouraged to participate remotely. The governor's order allows public bodies to meet entirely remotely so long as reasonable public access is afforded so the public can follow along with the deliberations and the board votes of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Board of Health is convening by telephone, telephone conference calls, video conference via Zoom, and as posted on the meeting agenda on the town's website calendar, identifying how the public may join. Please note this meeting is being recorded and attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and anything you broadcast may be captured by the recording. And I believe that pretty much brings us to the conclusion of the script, except to say that if you are speaking, please introduce yourself, and votes will be taken generally by roll call because not being present, it's hard to tell how people are voting. And other than that, if you are requesting to speak, you can virtually raise your hand, and at the appropriate time for public comment, the moderator, which is Cheryl, or David Martin, I believe tonight might be the moderator, will enable your microphone so you can speak. Thank you very much. And so we'll dive into tonight's agenda. The first item on the agenda is an update from our director of the health department, and that's Ms. Ball. Would you please bring us up to speed?
Yeah. Hi, good evening, everybody. So I have a few things to talk about tonight. One being the last meeting that we had last week, I mentioned the new travel order, but effective on Friday, the state of Massachusetts is now removing Rhode Island as a low-risk state. That means that if you travel to that state, you're going to have to follow the quarantine for the 14 days or produce a negative COVID test up to 72 hours prior to your arrival. So that's some new news for today. The state has also launched an initiative called #MaskUpMass, which is a mouthful to say, but it's an educational effort that's aimed at continuing to remind residents to wear the masks and stop the spread. So I'm gonna take a look at that extensively, and I'll get some educational materials out to the Acton residents as well in the coming week. In addition to this, and they're also using public figures to help, hoping that, I know they did it, Wally, the green monster, the other day, which is kind of cute if you haven't seen that. We've got some news this week, and I think I sent it to you, but I know you received it when it came through, that we got a public notification that arsenic was found in the water. So the MCL is currently at 10 parts per billion, and Acton's level came in at 11. And that was for the end of June of 2020. So notifications were sent out to the public. And I reached out to the water district to ask them, what the plan is with this. And I was told that they've already made adjustments and they've activated carbon filtration, which they believe will be the remedy to this problem, because they resampled, and those 2 additional samples came in at 5 and 6 parts per billion, which is under the guideline of 10. And thank you for the meeting last week. It was, I know it was very long, and I just wanted to let you know that I had a conversation today with the engineer of the project, and we went through every condition that the board imposed last week. Because if you recall, the conditions they wanted additional time to review those conditions. So I'm happy to say that there's no additional concerns with any of the conditions that the board voted. We're still working on the two that the board gave me authority to work on, which was the shelter and the nitrogen reduction level. So I'm currently looking at other projects for to try to find out what their nitrogen levels are, so to give us a good gauge. And then I'll also be discussing that amount as well as any conditions with the DEP prior to permit approval. So I just wanted to tell you that, and that's all I have for today.
All right. Thank you very much, Cheryl. Members of the board, any questions or comments for the health director?
Yeah, Cheryl, I was wondering, will the health department, Board of Health have any input into the opening of schools?
Yeah, so I actually, we're meeting next week or the week after. But yes, it's both myself as well as my counterpart in the town of Boxborough and the schools and then the town manager. But yeah, we have a meeting set up that we're going to be able to give input to. So I'm happy about that.
Thank you.
Mr. Cruz?
I guess I have two questions. One is going back to the water district. Is the last time I checked the website, they said some wells are closed due to maintenance delays due to COVID. Do you know anything about that?
You know, the only wells that I'm aware of that are offline is because of the high levels of PFAS. So I don't know. I don't know if they're closed due to COVID. I can reach out to them and find out, Mike.
Okay, let me just check the website. It'll take me. Yeah, their website still says they have two of the sources currently being available due to delays in maintenance activities caused by COVID-19 interruptions. So that hasn't changed on the website, at least since July 6th. So I don't know if it makes sense to get an update. That might be out of date on the website. It's just if you're talking with them this week, that would be good.
Sure.
Okay, thanks. The other one is I've noticed cases in Mass have been creeping up. And, you know, I'm just wondering your opinion. I mean, should we look at reinstating some of the restrictions that we lifted recently based on the increased cases?
Well, Mike, I don't mean to you're certainly welcome to ask Cheryl the question, but I believe Heather is up next, and maybe that would be
I'll wait for Heather. Sorry.
No problem at all.
Okay.
Yeah, I mean, the only thing I would want to add to that is we have conference calls with the state, and that's something that gets discussed. We do that about twice a week. And right now, from what I'm hearing from the state, they're not sure whether they're seeing a slight increase due to the fact that more things are opening, or if they're seeing a spike. So they're currently looking at that. We're currently talking about that. So Heather may have more to add on that. But
Great. Well, thank you. But before we jump there, just let me make sure. Any other questions or comments from members of the board? Any questions or comments from members of the public, Cheryl? Or you're driving tonight? Okay.
yeah, I'll do that. David does the screen, I do the people. So yeah, no.
Very
No
good.
comment.
Thank you. In that case, Director York, would you please bring us up to speed on what's going on?
Hi, good evening, everyone. It's nice to see you again, as always. So currently in Acton, we have 186 positive cases overall since the beginning of the pandemic. 4 are currently in isolation. 161 have recovered, and since the beginning, 21 fatalities have happened, unfortunately, which that number has not changed in quite a while, thankfully. As Cheryl said, Rhode Island is really the only big change to the guidance pertaining to travel. So any Massachusetts resident or anyone from Rhode Island coming into the state either has to have a test done 72 hours before coming into the state, or they have to quarantine for 14 days. Other than that, the guidance for disease surveillance still stays the same. It hasn't changed in about a week and a half, where they instituted a little bit of a change for symptoms and coming off of quarantine related to temperature guidelines. Originally, it was a 3-day, 72-hour stretch of no fever without fever-reducing medication, and now it is 24 hours within that 10-day period. Really, other than that, there's not a lot of changes on our end. We're still obviously doing the disease surveillance and tracing per the guidelines. I did hear Mike's question, and I can answer that if you would like, or if he wants to ask it again. I'm not sure if the protocol is that you want to wait for him for questions to be asked.
No, I would suggest please go ahead and
Okay. So as Cheryl said, they're really watching the numbers to see if, because things have opened up more and people are out and about doing more things. There is also a question of the hospital laboratory that had some delayed reporting. So there's a few pieces in motion, which Cheryl mentioned, and I've been hearing the same things, and they are keeping a good eye on that. I know there was sort of a big jump for a couple days, and then there was a decrease, and then there was another jump. But they're really watching not only the testing of positive cases, the testing of suspect cases. They're still looking, obviously, at hospital capacity as well as ICU capacity, and then the percentage of the state that they're trying to keep that percentage at a low level. So, they're still looking at all of those things, and I think, the governor and his team are doing a great job keeping an eye on all of those numbers. And I think if it gets to that point where they need to pull back, they will definitely do that.
Okay. Mike, does that sort of address what you were?
Yeah, it does. But if I can get more granular, Heather, keep an eye on state dashboard that comes out. So they do keep definitely an eye on percent positive total cases, which is important, but they also have other metrics that they're looking at. There's hospitalization rates, there's ICU, there's intubated cases, and for the most part these have been going down, but looking at the dashboard, it's like things like hospitalizations are creeping up, and we'd want to get the ICU cases down to 0 and intubations. That's the rate of decrease has been slowing. It's not really dropping anymore. So for me, it's
Agreed.
Looking at all of the data in, when you add it all up, it's like, I know the state, is keeping an eye on that, and maybe at some point we'll go back to stage 2 or phase 2 if the data supports it. But I guess I'm wondering, if Acton, if there's any appetite to, preempt this state action on this, just to keep our citizens safe.
Oh, sure. Keeping the citizens safe is definitely high on my priority list, as it is Cheryl's. We definitely don't want to get back to the point we were, 3 or 4 months ago. In the last 2.5 to 3 weeks, I believe, if my numbers are correct off the top of my head, because I don't have all the data in front of me for each day, but if my memory serves, we've only gone up about 7 to 8 cases in about 2.5 weeks, which is a big change, you know, compared to what it was. Yes, we definitely have new cases. I can say that the new cases are from people being more interactive with each other, but I wouldn't say that they are for specific reasons where Acton closed, you know, the parks, the, you know, NARA, those pieces. I wouldn't say that that has anything to do with what we're seeing. I feel like it's more so to do with folks going back to work, and being out in different areas of communities, not necessarily in Massachusetts.
Yeah, that's a good point. I think, yeah, there's a lot more travel. Like, you know, see
There is.
on social media, people are going to South Carolina and Florida and flying back. They probably should be quarantining, but I don't think they are.
Well, I'm hoping that people are following the travel guidance. I really hope they are. You know, but there's a lot of, just to put some things into perspective, as kids are going back to school early in other states, they have to be tested once they get there. And if they're not there for greater than a 6-month time frame, they're still considered Acton residents. So anyone that's positive who are out of state, whether they're on vacation or going back to college, they still fall under the Acton, you know, umbrella. They fall into our numbers as an Acton resident. So just to put that out there too, you know, you have to think about all these college students going back to different places within the United States that may have a much higher risk level than we do. Whether they're being tested once they get there, if they've gone early, they have to be tested within a certain amount of time before classes start. They still fall under Acton's realm, and we follow them, and their numbers are our numbers.
Okay.
That's an interesting point.
Yeah. Kind of scary.
Yeah, it is. It is an interesting point. So just to throw that in there, because as you know, the southern states do start much earlier than we do in New England.
Yeah,
Okay.
I appreciate your perspective on this, Heather. It is scary. You know, I don't think Massachusetts is immune from another surge. My view is
I agree.
we should keep a very close eye on the data with this, and you know, if we see it, we're at like 2% or 2.5%, right, for positive cases. If this gets to 3 or 4, we need to start thinking about what we're going to do. In my opinion.
I agree. I agree with you, Mike. I do.
So, Mike,
It's a lot of moving parts.
What do you think are the most effective measures?
Myself? Is that for
Well,
me or
actually,
Mike?
That's either one. I'll take it.
Mike,
I'll
you
take an
go
answer.
right ahead.
I can give my perspective, but Heather, if you can go first, since you're the expert.
Do I have to? No. You know, there's so many moving parts. You know, it's on so many levels. There's so many moving parts where, you know, I can honestly say in the last 3 weeks, we've gotten so many reports of cases who have tested positive, let's say, but they haven't been within the state. So but they're still considered Acton residents. So that piece to me doesn't make a whole lot of sense as a disease tracer, because the contacts aren't in the state of Massachusetts, but the number comes back to Massachusetts. So there's that piece. And then oh, gosh, it's such a hard thing to put your finger on. You know, people going back to work, I think maybe letting their guard down a little bit more because you're in such a well-known environment for yourself where you may not be as cautious as you are out in the community. And I think people need to realize that even though you are back to work and it's a safe environment for you, the coworkers that you're working with are still doing things that you really don't know what they're doing or who they're being interacting with. So I think there's so many different aspects that you have to look at. And as a state, we came from, you know, such a high positive rate, and we've really gotten to the point where we're doing such a good job. I don't want people to become lax. So I think that that's the biggest risk, is people become a little bit more complacent. People are feeling like they don't want to be quarantined to their home and you know, staying away from their family, but they really need to make sure that there's a lot of safety in numbers, you know, safety in what they're doing, and safety to, you know, safety that they're, you know, they know who they're seeing and who their family are seeing.
So Heather, if I had to put words in your mouth, I think what I heard you say is that the most effective measure that could be put in place to slow down or, you know, stop a new surge would be a stay-at-home advisory or order, something which may not be in the control of the Acton Board of Health, but it
Definitely
just,
not.
reading
Yeah.
into what I heard you say, it sounds like the
Yeah.
stay-at-home portion was the most effective piece.
I think it was really the most effective piece. I know that we need to move forward and we need to go back to work and we need to live our lives, but we can do that in a much safer manner than I think people are at right now. I think people are frustrated. I think they're tired of being home and tired of just keeping within a very small circle. I just, you know from talking to people, whether it's within Acton or people I know personally, family members, there's that piece of, you know, we're good, we're fine, we're where we need to be. But to stay there, we really still have to follow the guidance, the social distancing, the face masks, the face coverings, if you can't socially distance. That piece still needs to really, really be followed. And it's going to be quite a while before we can stop following that.
Okay, thank you.
So, yeah, that was my long-winded answer.
No, I appreciate it. And it took the pressure off Mike, who's next.
So if I can give my perspective on it, you know, my company Pfizer just started a phase 3 clinical trial. I think, you know, from that, if we can, do we have a flu clinic set up this fall?
So I don't have a date yet because I'm waiting for the shipping notification of when the vaccine will actually arrive. I typically get that in early August, when it will be coming, and I haven't received that yet. So as soon as I do, I'll start looking at dates.
Yeah, so for me, I think one thing we could do as a Board of Health is just make sure that, I think the plan is to have the flu clinic, but make sure that stays on track. The other one is we should have emergency authorized use for any approved through phase 3 vaccines. I don't know if it would be possible to also have a COVID vaccine clinic as well. That might be something to look at. But the other suggestion I would have, besides, like, you know, face coverings and social distancing, is I don't know if we can track students coming back into Acton and just make sure that they are doing the you know, 2-week isolation. You know, essentially, if there's anything we can do for compliance for those students coming from out of state. Just you know, a couple thoughts that I've had on this.
Like to attend MIT or BU or et cetera.
Well,
BC.
MIT, BU are in state, so I think the risk is lower, but, people going to Texas, Austin,
Oh, I thought you meant people from Texas coming to attend MIT.
So MIT is in Cambridge, so I think that, from a Acton risk, that's probably pretty low. But, Acton kids going out of state and coming back and, like a typhoid Mary kind of thing,
Okay. Dr. Taylor, I see you unmuted. Do you wish to have a comment for?
Yeah, really? I think we're in the midst of a pandemic. As we lighten up a little bit, there'll be more cases. I think it's ridiculous to think you can protect Acton. And, I read somewhere how many students are coming into the Boston area. Thousands, and they're coming from California. They're coming from all over. So Boston has more of a problem than we do. But frankly, if you want to consider saying anyone driving into Acton should spend 10 days isolated, maybe that'd do something, but you can't let anyone out of Acton.
Oh, it would get us on the news.
Yeah, I don't think there's much that we can do in a community of 23,000 in a state of 6-point-some million.
Well, you do actually raise an interesting point, and I guess I didn't have the thought well formed. You're right, Mike. People that go to MIT are in Cambridge, but I happen to know of at least one MIT professor that lives in Acton, and I'm pretty sure there's more. So they have the opportunity to bring it back home, and and the same for BU and BC and Northeastern and et cetera.
For any of the schools, there's no way to gauge and no way to follow who in Acton goes to any of those outside schools and when they leave and when they come back.
Right. So, Ms. Becerra, I think you had a comment as well.
Sure. I just have a quick question, and forgive me, Heather, I'm pretty sure we talked about this in a previous meeting many months ago, but for Acton's positive numbers, that also includes people who tested positive for the antibodies?
Hi, Joanne. So originally, yes, I would say yes, as the state guidance initially did include that number, but as they have changed the guidance, I believe about a month or so ago, no, those numbers do not include anyone who tested positive for antibodies who within that investigation that we do not have symptoms within the last 14 days. That would be the only time that they would be considered a positive case at this point.
Okay, because I remember when we talked about sending those letters for people who tested positive for the antibodies but refused to get tested for the active virus. So I just wanted to clarify that.
Yep. So at that point,
And
yes, they were counted as a positive because that was the guidance from the state of Massachusetts, but that has changed.
very good. And just since we're talking about college students, as a parent of a college student, I can tell you that my daughter is going to school out of state, but they are testing the kids weekly. And they are testing the kids when they arrive, and they have to stay in their rooms for 48 to 72 hours until their tests come back. So the students, I don't want to talk about all colleges, but this one anecdote of this one school, they're taking it very seriously, and students, the dorms are being de-densified, for lack of a better term, and a lot of the classes are remote or hybrid. So I think we should be concerned about students going to school and then coming back. But I know when they're at the schools, they're being looked at very carefully, and if they do test positive, they'll be immediately isolated. So hopefully if they do come back for weekends or for Thanksgiving, they won't be a typhoid Mary.
No, that's good. That's good information. I know a lot of the schools are treating it somewhat similar. Some are a little bit different depending on which state they're going to. I also know that there are schools that have, you mentioned Thanksgiving, have removed the Thanksgiving vacation completely, and they're actually getting classes done sooner so that kids can, they're not going back and forth between states. They're going to school, they're finishing school, they're coming home. There's no back and forth between Thanksgiving and Christmas break. So they are looking at a lot of different variations. You know, a lot of our local schools, as you all know, are doing more online classes. My own daughter goes to a state school, and she is doing full virtual classes. The only thing she's not doing virtually is science labs, but they have, you know, notified us that that could change depending on, you know, where the state is.
Okay, thank you. Mark, did you have a comment or question?
Yeah, a few. Thank you so much, Heather. Few things. Going back to the college kids quickly, I know a lot of the colleges plans that if a student is positive, they're immediately to go home, so they're isolating them from the community. So I think we need to plan a little bit about that, because that could be a big issue of transmission within our town. Yeah, I guess the other question is then the testing delay, which obviously impacts a lot. What are you seeing for the trend? Is it improving?
So good questions. I do know that we have actually seen or heard of a couple of students in other states that have gone back early for sports prior to classes starting, that they, you know, other students are testing positive and they are a contact case. They're not sending them home. That's not the guidance from that state that they're in. So that's a really good question. If they are identified as an Acton resident, we again follow them regardless of what state they're located in. So, you know, we hopefully keep a good eye on that as they are Acton residents. If they are a resident of another state for greater than 6 months and that's their mailing address, if their family is here and they come here, I don't know if we'll necessarily find that out. If they're not an Acton resident, if someone doesn't notify us. So just as an aside, I apologize. Your second part of your question was?
Well, that's fine. The testing, the time.
Oh, the testing
to results.
Thank
How is
you.
that going?
So it's been going really well. I mentioned at the last meeting that we did have one person that there was about a week or so lag time of a result coming back. I will tell you that I did get notified by someone who self-identified that they did test positive. And when I called looking for their testing, they were tested at the CVS in Lowell, just as an aside. And I called CVS to get results. And on their answering machine, not machine, but their message before you have to start pushing numbers to go to which department you need to go to, they did talk about a 6 to 10 day lag time with test results if you were calling as a resident or, you know, someone who went to a CVS. It was a 6 to 10 day lag time because of, and it specifically said because of the states where there is a very high testing and positive rate going on. Unfortunately, I think those states south of us and in the Midwest that are really having a surge, if they do have CVS doing their testing, there will be a big lag time, unfortunately. And for us in Massachusetts, we have had quite a few CVS locations within the state that are doing these tests. And my hope is that that won't continue for us as our numbers stay low. But, you know, there's no control on our part of where that lab or how overloaded they are if other states are sending test kits to those labs.
Okay.
So
Correct.
hopefully, you know, we'll keep going where we have been. You know, fingers crossed. We don't want to get back to that point that we were in March.
Yeah, it's critical. Are you seeing asymptomatic positive cases in town?
Only a few. Over this whole time frame, there's probably been maybe a handful
Okay,
of asymptomatic cases. Since March,
yeah,
maybe a handful.
All right, I didn't know if you were seeing more recently or in the beginning. And
No, not any more recently than we were in the beginning.
has the demographics changed as far as the age and the number of contacts?
So age, as I'm sure everyone sees on the news, seems to be anywhere from the mid to late 20s to early to late 50s. Seems to be the norm for us, which is a huge age bracket. We're not seeing the elder population that is the most at risk, thankfully, even with the assisted living and life care of Acton in town, which are doing very well still, which is great news. Contact cases definitely are a larger number than they were 3 or 4 months ago. As time goes by, you know, I think for people going back to work, like we talked about, people seeing family more, people going and seeing friends, that definitely has made a big difference in the amount of contacts that a positive case would have. March, April, I'd say 2 to 3 was the norm. Now it's anywhere from 8 to 15, just to use the number loosely.
Dramatically increased. Well, thank you very much, Heather.
Thank you.
Thank you, Mark. Any other questions from members of the board? In that case, Cheryl, any questions from members of the public? You're on mute, Cheryl.
Yep, I figured that out. I do have one. I'll allow Diane Oster to talk. Go ahead, Diane.
Hi, you probably have been following along with the regional school system, and I know, Cheryl, you said that the superintendents are going to be meeting in a couple of weeks, and I think we had heard the same thing, but as we go through some webinars with lots of families online, and as we get ready for school to open, the school committee's voting tonight on the transition plan for hybrid, and parents had to decide by Sunday night which option and things like that. I guess I'm just curious if you have an inkling of what kind of metrics we were likely to use with schools, because the DESE guidance that came out July 17th makes it seem pretty situational around whether it would be a positivity rate or whether it be like a number of cases. And I just was curious about that, because I think families would have more confidence if they knew that, but they still had to make their decision even without some of that information. So I'm just curious if the board is thinking of any particular metrics that might apply to K-12 school that's opening, well, to be determined. I think you noticed that in the Globe today, the digital version, most of the towns have published their plans and they're online.
Okay, thank you. Heather, this is probably more in your area if you feel comfortable answering it.
Hi, Diane.
Hi.
How are you?
I'm good. I just feel like a lot of the phone calls we need to make, because we are checking in on other things like, did parents catch up on the other vaccinations that are normally for kindergarten start? Obviously, we need to be flexible because they might have needed more time to get to those appointments, but families are just, there's really families of young children are really finding it very stressful with all kinds of things to think about, especially childcare. So I would just be curious if there is any thinking behind what could be the metrics once school opens, because it would be kind of good to know.
So I honestly have not been in any of the conversations about the schools reopening. I don't know if there has been a discussion about the metrics. I don't know if Cheryl has any other input on that, and I apologize. I haven't been included in that conversation.
I'm sure you're busy. I've been following along. I know how busy you are. I think that right now, everything in our transition plan, which is posted at the regional school system, is to follow the state of Mass, the DESE education department's guidelines. And they're pretty specific. It's just that the average family with, depending on their healthcare literacy, I'm not so sure is going to be really, really easy for them to understand what would it take. You know, and I know that our Dr. Bentley and Peter Light and everybody's going to meet with the right people to get all this in place, but time is going by and time flies. So I just was curious if board members had any ideas.
Yeah, I'll just say it's not a topic that we've brought up at previous board meetings. So I don't, at least personally, I'm not qualified to address it, and I don't know if any other member would want to volunteer or not. But it hasn't been something that's been discussed among the board.
Okay, I'll just wait until our superintendents meet. Cheryl, you said it was a few weeks away.
Cheryl, the question was, when are the superintendents meeting to decide on the school opening
It's,
plan?
sorry, I didn't hear it. There's definitely, I don't have the date in front of me, but it's in the teens. It's August in some 14, 15, 16, something like that. You know, I have read a little bit of the Department of Secondary Education guidance, and, you know, it's pretty clear, even conversations with the state, that that's what's going to be followed. There has been a little talk about whether that what they've put out now is going to change, and I would suspect it will. But I anticipate that conversation taking place, you know, when we have that meeting with the schools. You know, if the board's inclined, you know, if you want to discuss that prior to the meeting, that's fine too, but that's, you know, up to the board.
Okay, thank you, Cheryl. Well, hopefully that answers at least at least you have an honest answer, ma'am. It may not be the information you were seeking, but
Bill, can I follow up with Cheryl?
Sure.
Is that protocol published on mass.gov?
I haven't seen it on there, Dr. Bill, but I could forward it to the board.
Okay. Because often I remember they did it for daycare centers, they did it for other groups, nursing homes.
I think it's in the DESE website, Bill.
I'm sorry?
Department of Education, Secondary Education.
Okay.
It's on their website with a lot of the specific protocols.
Okay.
But I mean, I think the metrics are not going to be just one metric, but all the different criteria. And obviously, I think it's going to be evolving as well, as it has over the course of the spring and summer and going into the fall.
Okay, so maybe that's a reference for Diane to check out.
No, I actually have those guidances. I was just trying to find out, since families are, you know, I know the superintendents are going to get after this, so I'm fine with that. I was really just trying to figure out, is there going to be, you see things like states saying we're going to not have certain school days if there's 5% positivity. All these different things are out in the press. And I was just wondering if there's any Acton-based decisions made about what might change the course of school. School is opening September 8th for students to return.
I think time will tell on that, definitely. And as I mentioned, I do think that they're suspecting that the guidance will change from the DC. So we can keep on top of that, Diane.
Okay, And was there any other information, Heather, on a rapid test coming to Acton Medical or any of the testing sites around the area? That's another question parents are asking. No. Okay.
Yeah, I've heard, not that I've heard of Lady Diane.
Okay.
All right. Well, Cheryl, any other questions or comments from members of the public?
There is not.
Very good. Then the next item on the agenda is actually back to you, although I suspect it'll be pretty quick. Are there any required board actions to be responsive to changes in state guidance?
No, I don't have any on that. I probably would like just to ask a quick follow-up on other updates if we want to jump to that, unless somebody else has something on the next agenda item.
Well, I think other updates is the next agenda item.
Okay, so Hazardous Waste Day is scheduled for September 19th. As you know, we put off the one in the spring. So I'm just wondering what the board's feeling is on holding that day.
Dr. Bill, you may have been slightly circumvented there. Was there something on the previous topic you'd like to say?
Yeah, the state guidance, I'm just curious on these state directives for other states. They still mention the 14 days of isolation, whereas I think the state Department of Health now recommends 10 days of isolation. Is there a reason for that difference?
Heather, do you know that? I mean, I know there is a difference there, but I don't know.
Are you talking, Dr. Bill, about the quarantine if you're coming into the state of Massachusetts?
Yes, correct.
So the travel guidance.
Yes. But
Okay, so the travel guidance for I'm sorry?
Why is it 14 days when isolation has been reduced to 10?
So the travel guidance is 14 days for coming from a high-risk state. So anyone coming from any state other than the New England states, so Maine, New Hampshire, Vermont, and then Rhode Island has been taken out of the mix because of their increase in numbers. New York, New Jersey, Hawaii, I believe, are all the states. And if I'm forgetting one, I apologize. Someone correct me. So the guidance for that is the typical quarantine guidance, which is a 14-day quarantine for anyone coming from a high-risk state, which goes.
Oh, we lost her.
Uh-oh. Yeah, it was getting spotty there. Well,
I withdraw the question.
Okay.
very good.
Yeah, Dr. Bill, it's probably has to do with risk. If you're coming from a high risk area, they want you to do the full 14.
It looks like Heather has rejoined us. Heather, are you
Are
back
you
on?
there? I apologize.
No problem.
Oh, are you there? I'm sorry, I lost you. So the quarantine guidance goes along for this coming in from high risk, follows the quarantine guidance for any contact cases of positive cases within the state of Massachusetts. The 10-day isolation is for a positive case based on primarily when they started showing symptoms, and then you do the contact tracing 48 hours before they started showing symptoms. So in the long run, it does come out to a 14-day, but the guidance per the CDC and the state of Massachusetts is isolation for positive cases is at least 10 days with a 24-hour stretch of no temperature without fever reducing medication. So there's a little bit difference between the isolation guidance and the quarantine guidance within the state of Massachusetts. But the travel guidance follows that quarantine of 14 days.
All right, well, that makes sense. Thank you.
All right, well, thank you.
Sure, thank you. Good question.
Well, as always, thank you again, Heather, and thank you for keeping on top of this for us. So, oh, I'm sorry. Please go ahead.
No, I was going to say thank you. I appreciate it. My pleasure.
Oh, well, thanks again. So back to your question, Cheryl. I guess I would be interested in input from members of the board. The real question for me is, I think it would be good to do a hazardous waste day, considering that that probably means things have been piling up in people's garages or basements for a little while now. But do you have a sense of if we can do it safely? That would be the primary question.
So, the way we run the event, it's primarily people staying in their cars. We do have occasions where people get out of their vehicle to pop their trunk, or, they have to jimmy something because they've got a secret way to open it, or, but I do believe that we could require people to stay in their cars, and which would minimize risk. I believe that we could social distance. When the people go through the DPW garage, they also stay in their cars. But, there is a time period where the Clean Harbor, or the Hazardous Waste Day contractor would be speaking directly to the resident, as well as, myself and our staff. So there's a little bit of risk there. And, there's a potential to get a backup. But again, with people staying in cars, I feel like we could make it work.
Okay. Comments from other members of the board? None?
Bill,
I was just going to say, I agree that it could be done safely based on what Cheryl just mentioned.
Yeah, I think you can do it safely. I think it should happen. I think if you can pick up a pizza, have a guy come out of a pizza store and give you pizza, people with hazardous waste training can certainly handle a situation adequately.
Mark?
just a few thoughts. One, if we could try to have the paperwork pre-done so people aren't spilling it out and doing all those things. We could set up appointments to minimize the backup. I know there's some logistics to it, but I mean, obviously, if we could have some of the materials more outside than in the garage, like tents or something, I'm not sure how that could be implemented, but certainly dealing with the contractor with their risk management plan, you could deal with that. So I guess the point is, yeah, if we can have the transfer station open and it's an essential service, it seems that it probably is necessary to schedule it, and certainly trying to pick a good weather day and not where everybody's outside would be better.
Okay. Cheryl, do you think that's
Yeah.
good enough guidance?
Yes, I do. Thank you.
All right. Thank you. All right. I believe that brings us to the 8 o'clock agenda item. No, the 7:45 agenda
Yeah,
item.
we're a little late.
I apologize to the folks for 4 Cherokee Road, but Cheryl, would you mind introducing the topic?
Yeah, so as Bill mentioned, this is 4 Cherokee Road. They have put in a request to put a full bathroom in their basement, and they're looking for a variance from 310 CMR 15.229(1). That requires that any pump, so like for a basement, would need to pump up to the septic tank. It requires that tank to be 1,500 gallons. They currently only have a 1,000-gallon tank. So this homeowner is present tonight, and I can let him talk in a minute. But so normally, and we've told him this, that, we wouldn't normally recommend this variance because, we don't want small particles being pumped into a septic tank and have them go out and ultimately clog their leaching field. So they're not designed for that. And in the past, we've only issued this with the person putting a 1,500 gallon tank in. So with that being said, the homeowner has reached out to a plumber, and he's done a lot of work, which I give him a lot of credit for. And so what they're proposing now, and I sent you later today the spreadsheet that he worked out with his plumber, and he can probably talk about it a bit better than I. But so their plan is to bring have the pump bring the sewage up one floor and then out the main, so out gravity through the first floor. So they scaled it back. It's in a sense going to work like gravity. They did the calculations, and they were able to lower the flow rate. So with that being said, you know, we could recommend this. We would ideally like a effluent T filter installed in the septic tank, just to try to catch any of those particles that may enter in there. We feel that it would be a safe, you know, a protection measure, and one that would be very minimal to the homeowner, certainly a lot cheaper than replacing the tank. And then the only other thing that we should maybe consider is currently this person owns their home. You know, if they currently have an active Title V, technically they could sell within 2 years without, you know, getting another Title V. To me, the way to make sure that this is protected for the current owner as well as future homeowners is to, you know, take a look at that to make sure that the particles are not going out to the leach field, and that would be caught during a Title V. So while I'm not recommending that a Title V be done, I do think that if this homeowner were to sell their home, a Title V would obviously be required. But again, if he has one on you know, already done, it wouldn't require a new one being done. So I would say upon sale, that, you know, a Title V be done just to protect any future homeowners. So that's all I have.
All right, thank you, Cheryl. Just a brief follow-up question to what you just said. Would you also have a condition that should the system fail, that the replacement system incorporate a 1,500 gallon tank, or would you think
If the system were to fail, they would absolutely have to bring it up to standards. So yes.
Okay. Well, in that case, with the gentleman who's requesting the variance, if he'd like to add anything, this would be a good opportunity for him to do so.
Yeah, so it's Eric Johnson. I'm going to allow you to talk right now, Eric. Go, you should be able to.
Good
Yes.
evening.
Thank you, Ms. Ball, for the opportunity to speak tonight. You did an excellent job summarizing it. As you said, we were able to work with the plumber and the ejector tank manufacturer to come up with a plan that was would appease the board or the health department and basically lower the gallons per minute that would be going into the tank, and also the speed at which the sewage would be going through the pipes themselves. And we believe that our plan will still provide the same level of environmental protection that Title V would if it were to be enforced as written.
Okay, thank you. Mr. Johnson, if you don't mind, I actually read your calculations, and the one thing that I didn't see in there, and maybe it was incorporated, you already made it when you selected the number, but normally pumps are rated for a head, meaning how high, the flow rate is a function of how high up you pump the liquid. And you mentioned that you use the pump's rating. Did you account for the head, the distance up when you calculated the rating?
Yes, that was the biggest factor that we were able to adjust with the plumber. The original plan was to just go to the ceiling in the basement and then out, but by pumping the sewage into the wall of the first floor, that gave us enough of a distance to go vertically that it would slow the flow rate enough to be proportionate to the required maximum with a 1,500 gallon tank.
Okay, thank you. Questions or comments from members of the board?
Yeah, this is Mike. I have one question for Cheryl, and I'm not sure, maybe this is the first time, but has this been done for any other homes?
No.
Okay, so we don't have a good comparator for this, whether it works or it doesn't. No,
Correct, and that's why I feel if we could put those additional safety measures that I talked about, I would feel comfortable with it.
okay.
Mr. Conaby.
Cheryl, are you saying that with these additional conditions, the department, it recommends the approval, or you still don't recommend it?
I mean, like you said, it's uncharted waters, but I do believe that the plan, slowing down the rate, with them, bringing it up to the first floor and adding the effluent T filter, and I would be enough protection, environmental compensation to prevent that system from failure. But the catch-all would be, again, having the homeowner do a Title V prior to sale, just to double check. I mean, it's like I said, it's uncharted, so it's hard to say, but I feel like this is I feel like a lot of work was done, a lot of conversation took place, and I believe this can work.
All right, yeah, I mean, typically these have not been approved. I can't remember any of them.
No.
And people typically install a second tank, but I think you're correct. I mean, some of the things that we've done where these had approvals for increases flows have required that they have the system inspected prior to installing the pump. So you know you have a working system before you go, that you have the system pumped annually, to be an effluent T filter on the tank. Then the other thing that we've also seen is that, if you're looking at this flow, I think the plan ought to be subject to department approval to make sure you have the right head, right flow, right distance. And obviously with the transition from pump to gravity, you're going to now have to make sure that the flow doesn't leave the solids behind. So you're going to have some issues there. I guess I would just say throw that back to the department for approval. But you're suggesting that they inspect it if any sale or transfer. Most cases, you now have a non-compliant system. I think what we've also done is just required the homeowners to upgrade the system. So it's a variance for their use during that time period. They're willing to take the risk and maintain it, but that's not something. So we've typically said that the approval is only good for this homeowner, that if there's any sale or transfer, that the system has to be upgraded. That's typically been the conditions we've looked at, not for this variance, which has never been granted, but for other ones, for other increase in flows.
Okay, thank you, Mark. Any other questions or comments from members of the board? In that case, I just asked Mr. Johnson, Mr. Conaby made a proposal, and I think it's probably new to you, so I just would be interested in your reaction. His proposal is that you would be free to use the system as proposed with the variance for as long as you own the property, but that if you sell the property as part of that sale, it would be upgraded to a normal or a fully compliant system. Is that acceptable to you?
It is, if that is the condition that would grant the variance. I believe that the Title V inspection done upon sale, I do not currently have an active one, so I would need to do one regardless. I feel that the Title V inspection would tell if the system was still functioning properly. So I do not believe that I would need to replace the whole entire system or the tank to bring it up to current code. However, if that is the condition that would grant the variance, then I would agree to it.
Okay, well, thank you. That's a reasonable answer. I guess then maybe it would be worth board discussion on, what do people feel about that particular condition? Is it, as Mr. Johnson says, well, if it passes a Title V with the variance, is that acceptable? Or, do we want to not allow the non-conformance to propagate to a new owner?
Yeah.
Mr. Cruz.
Yeah, Cheryl, how old is this system? I would assume pre-Title V since it only has a 1,000 gallon tank.
I don't have that information in front of me, but Eric, do you know?
Yes, the system was installed in 1992.
Oh, okay. So, yeah, I guess by the time you sell it, it might be time to replace it anyway.
Yeah, hopefully you'll be a long-term resident.
That's the hope.
That's what we like to see in town.
I mean, yeah, and keep hanging on there even after your kids leave school like me. And Ms. Becerra, I think, Joanne, you're about in that zone, aren't you?
Yeah.
I'll take
Maybe.
that as a yes.
Yeah, no, I feel it's kind of a slippery slope. And I feel that I'm in agreement with Mark's suggestion, just because we want to be cognizant of all these, precedents that we're setting and exceptions. And I think it's only fair that if and when the property changes hands, that the system become fully compliant.
Okay, thank you. I actually was just referring to your having about to become an empty nester, but I do actually
Oh gosh,
appreciate.
no.
Oh, I'm sorry. I
No.
thought.
No, I live in a 2-family with my mother-in-law, and she's hale and hearty at 80, almost 86. So
Okay. I
hopefully
was.
we'll be here for a while.
I was just thinking but you won't be a client of the Acton schools anymore, will you?
No. Those days are gone.
Yeah. Okay. But I digress. I apologize. Members of the board, any other questions or comments? Cheryl, is there any input from, I believe all abutters were notified. Was there any input from an abutter or other
I don't
member of the
see any.
public?
Yeah, there's nobody with their hand raised, no.
All right, thank you. In that case, I believe, Mr. Johnson, I'm sensing the board is of the mind that they would probably allow this, but with the condition as Mr. Conaby has suggested. So and I think you've indicated that would be acceptable to you. So in that case, Mr. Conaby, would you be prepared to make a motion?
Yeah, I was just asking the questions. I wasn't saying that that's what I would propose. It would be best to obviously have a compliant system that's, coming up on 30 years old. But yeah, I think we have to be cognizant because we've also denied this request to a lot of folks. And I think that anecdotally, we've heard there are folks who have put pumps in. And obviously, we'd much rather people try to provide a good solution and do it properly. So I guess with that in mind, I guess I would make the motion to grant the variance subject to the conditions of that it be inspected prior to installation, or that be pumped annually, that the effluent T-filter be installed and maintained in the existing tank, and that the installation, including the piping and system, would be subject to plan approval by the department, and that finally that the system be upgraded to a compliant system on any sale or transfer of the property to a future owner.
Very good. Is there a second?
I'll second it, Bill.
Thank you, Mr. Cruz. We have a motion made and seconded. I ask, is there any further discussion from members of the board? If
Yeah,
not,
I
in
just
that
had a
case-
question. I had a question.
Yes,
I do remember several other of these situations. So are what we're saying is if the other people who came before had come up with this solution, we would have approved it?
well, I obviously can't predict what might have been, or I would be much richer than I am now. But I have to say that this was as Cheryl indicated, this is a creative solution to a problem that normally the creative solution wasn't proposed before.
Okay, that's kind of what I thought.
You know, looking back, I don't think there'll be ever a sewer system in the area, but we probably should have put in the condition that if a sewer is available, they would connect rather than having the non-compliant system. But that's dreaming in this area, especially past history. But I guess, Tom, to your comment, that's what we talk about, the precedential value. I mean, if someone else came in, they got denied, decided not to do it, if they came up and met the similar conditions and application, then I think it would be, you know, incumbent on us to be fair and to provide the same opportunity and solution for them.
So might we not want to have that as part of a regulation or part of a guidance anyway?
I would think that we
Somebody should come up with this situation.
it's going to be a variance every time because of the regulations. If it becomes a substantial regular event, then we can look at modifying the events. But typically, until you have a lot of cases where it becomes a hardship and a big issue, that isn't normally the case. And I think probably watching and see what happens for a while would be more prudent than just quickly changing the regulation.
Okay,
Yeah, and I'll anticipate that we're not going to see a flood of these come in. But then again, as I previously mentioned, I'm not very good at predicting the future. Okay, so we actually have a motion made and seconded. I'd like to call for a vote. I will start at the top of the list this time, which is Dr. Taylor. How do you vote?
I'll vote aye.
Thank you. Mr. Cruz, how do you vote?
Aye.
Mr. Conaby?
Aye.
Ms. Becerra?
Aye.
And I also vote aye, so the motion carries unanimously. Good luck, Mr. Johnson. I do applaud you for both your perseverance and your creative solution. I hope it works to your satisfaction.
Thank you very much. I appreciate the chance to talk to you this evening.
Thank you. Have a good evening. Sorry for the delay.
No worries. Thank you.
All right, so that actually brings us to the minutes. I believe we have 2 sets of minutes to review.
We do.
And before we move on, I apologize, just 1 second. Mark, you had asked about the arsenic in the water and that wanted to discuss it. Was that covered to your satisfaction tonight?
I had suggested that we make sure everyone knows about it, and the Water District was kind enough to provide some additional information, and Cheryl did a nice job summarizing. And I think if we have more questions concerning the hour, we can just tune into the Water District's meeting tomorrow night. But it sounds like they've taken corrective action, so it's not as much of an imminent concern at this moment, but it's obviously concerning. And as Mike pointed out, which wells are online during the COVID, there's a lot more questions. So yes, they've addressed my questions and requests at this time. I think we definitely need to continue monitoring it.
Okay, thank you. Okay, the first set of minutes is from July 13. These were ones that we held from our last meeting. And I guess I would ask, I actually had one very small comment. I did get a chance to ramp up my pickiness filter. Actually, I know I have 2 comments. So if you don't mind on these minutes, looks like we're bringing them up, so that would be great. This is,
Yeah, we need the third.
yep, that's the same one. Okay. If you would scroll down, Mr. Martin.
Minutes, Bill, the 29th or 13th?
We're doing the 13th.
He's showing the 29th. Oh,
okay.
Yeah, you've got the wrong one on the screen.
Yeah, that's good. So please stop right there. Back up. It's the paragraph that's labeled face coverings. It's on the first page. You'll see in about the 3rd line, it says Governor Baker stated that they must be worn on. I'm sure that should be if you see it.
I'll fix that.
Okay. But the next one's more interesting. It's the 2nd page on plastic bag ban, and you can almost see it. If you actually parse what it says that the plastic bag ban, it's rescinding the plastic bag ban and is now re-allowing the use of plastic bags.
Oh, yeah. Not allowing. Yeah, good catch. All right, thank you.
Yeah, and I don't know quite how you parse this. Now, re-allowing not the use, so I just changed the word use to ban,
Okay,
but up to you.
okay.
Okay,
See,
I see you
Cheryl,
put the vote in.
I found an inherent contradiction. If you look in the conditions posted by Evan, number 24 is still retained, which says the septic tanks must be restricted to zone 4, while in the meeting, we allowed it to be moved to zone 3.
Can you, David, can you move down so we can look at those conditions?
So 24 is a condition that shouldn't be posted in the minutes any longer.
Oh, yeah, that was an older condition that we had, but, so what's the board's, would you like that removed or would you want that to say zone 3?
I would recommend we remove it. It's clearly a superfluous artifact, and the board's, motion and intention was to allow them in zone 3.
Yes.
Okay,
I think those from the prior meeting, so we deleted that. But I think the next point with the approval of the plan 26 really covers the change that we authorized.
Correct.
okay, thank you.
All right. So I didn't have any other comments. I see you did, like I say, capture the vote. That's great. Any other members have any comments on the minutes from July 13? Does anyone wish to make a motion to put these into history?
I'll make a motion to accept.
Very good. I assume you would also like the changes noted incorporated?
Yes.
Very good.
Especially yours, Bill.
Uh-oh, I'm in trouble. Mr. Conaby, it looks like you might be in a position to second.
Sure. Second. With
Very
the
good.
corrections.
Thank you. Motion made and seconded. I'll start at the bottom this time. Ms. Becerra, you are unmuted. Did you have a comment or do you wish to vote?
I was going to make a motion, but I got beat to it.
Oh, well then,
So I will vote aye.
thank you. Mr. Conaby,
Aye.
Mr. Cruz,
Aye.
Dr. Taylor.
Aye.
I also vote aye, so the motion and the minutes are accepted. Thank you. Please turn our attention to the minutes of July 29. And let's see, I believe I had one very minor comment. Oh, yes, I did. It's on the PFAS presentation on page 2. If we go down about the 5th line from the top of the presentation, no, it's more than that, it's about 6th or 7th. It says the DEP did a take-back program throughout the state of Mass. And Mass is not capitalized, so just was going to suggest you make it clear that it's not its weight, but it's the Commonwealth of Massachusetts.
Okay,
So, capitalize it and spell it Massachusetts or something.
yeah, okay.
Let's choose the word Commonwealth.
There you go. That works too. And I don't believe I had any other comments. Any other comments from members of the board?
Yes, Bill. I was looking at the draft minutes about the permit conditions regarding 4 and 5, and I think we need to pass in these because that doesn't reflect exactly the motion, and I didn't have a chance to go back to get the exact wording and send it to Cheryl. Then had been able to look at them late today.
Okay, so this is
These are the permit conditions for the school, 4 and 5.
these are the ones that they were excited
Very
about.
concerned about. Yeah, those words were not the words used in the motion. So I think we need to go back and get those proper because this is a very important part of that process.
So Mark, just for my own, edification, are you saying that the permit conditions as stated in the minutes are incorrect, or that the vote?
No, because the permit, we did vote to do it, but the conditions of the permit 4 and 5 are not the wording used for the motion of the changed conditions. And
Okay, these are,
that's what I'm saying. We need to go back to get clarified, because what those permit conditions are that was voted are not exactly as worded here. We need to make them consistent and to be applied into the permit.
you're right. So these are the original ones. You're right. These aren't what we
No,
actually
these are an
voted.
amended ones. These are not
Yeah.
the ones that were at the meeting. Cheryl changed because, and that's why I was able to pick up on it, because we talked about the owner shall install and maintain a nitrogen removal system if the effluent water quality exceeds the limits as approved by the department, was what I believe we had said in general. I have to go back and listen to the tape to get the exact language, but you know, that's not what's written. So I think we have to be clear.
Okay, that's fine.
So you're right, Mark. Initially when you did the motion, you had them up in the top part where, you moved to, and when I wrote it up there, the words that you used, it didn't really make a lot of sense. So that's why I put them down there, and they are more of a summation. So, I can listen to that tape and get the exact wording and send it to you for review if you want, and then we can bring them forward for the next meeting.
Yeah, I think that's fine, because they're an important condition. What the whole point of it is that we need to be able to have those, because that's going to be in the permanent condition of a very large system, and that wording is very important.
Yeah, so I do know that I promised the schools, a list of all the conditions so they can incorporate it on their plan. But
I don't think this isn't going to affect that, really, is it?
Well, yeah, it is, Bill, because whatever's in this minute should be what's on, because that was what should be approved, which would be on the conditions sent to them, which they want to put on their plan. So they all have to be the same.
Oh, no, I understand, Mark. I guess what I'm saying is the conditions on their plan, this wouldn't be a condition that would show up on their plan, is it? Since it was, it's not, what am I trying to say? It's part of the plan. In other words, they're not going to build.
yeah, true. It's taken down to our level, but you know what, Mark, you and I, can we work like offside? I'll listen to that tomorrow, the tape, and get your exact wording. I probably have it written down as well when you were actually making the motion, but like I said, it was difficult to figure out how to write that. So
I'll be happy to work with you. And I just want to make them accurate and
okay,
appropriate for that. And the last comment, earlier you're talking about the monitoring wells. I think one of the things that we need to look at is they're going to be installing the wells when they first install the system prior to use. So typically they would do a background set of water quality testing. And I think that would partly be the basis for the decision of how it's operating. So in other words, what the baseline is, then what a good operating system is, and then you'd have it, with DEP's consultation and action limit when additional steps may be required if we have a situation where the system is not operating properly and is a concern for the health and the environment.
So you're talking about condition number 3?
Yeah, but I think that's, we delegated back to the department. I was just providing some additional information. We can do that offline. It's getting late.
Yeah, it's 4 and 5 were so I think it would be 4, actually, not 3.
In my conversations today with the school, we definitely talked about conditions 3, 4, and 5. So
Okay.
I'll talk with Mark. I'll listen back to the tape, get that exact wording, and then figure out the best way to put it and bring it back for you at the next meeting.
Yeah, and I think whatever the monitoring plan by the department should be consistent with other systems in town, and what DEP recommends is, I think, what the plan is there for the department to approve.
Yeah, but actually, I'll just put it in a different language from what Mark said, just for my own. What Mark, I think, is saying is we should take a baseline on the monitoring well before the system is put into use.
Correct.
because if there's some level of nitrogen, say, in the groundwater now, then it would be actually unfair to then, that should be, there should be some level plus what's there already there as the action threshold.
Okay.
So, okay. Sorry, it took me a second. I managed to bury my copy of the agenda in all of the minutes that we had. But I believe that brings us to the end of tonight's business. Are there any other questions, comments from members of the board? Cheryl, do you wish to add anything?
No, and we've lost our audience, so.
The one person who was our audience is left.
Yeah.
David's hanging in there, though. He's tough.
Well, television and radio are on.
All right. So often this is Dr. Bill's favorite motion.
I don't want to dominate that. Bill, why don't you do the honors?
Oh, well, normally it's not, it's not unheard of, but it's not usually my role. But I see Ms. Becerra and Mr. Conaby have both unmuted. So, and Mike.
I'll let them go on
this is going to be a jailbreak.
I was just going to ask, when's the next meeting before we adjourn? That was my only question.
It's a week from tonight.
Okay. Do you anticipate we'll be needing to have the meeting?
Currently, there's nothing scheduled for that agenda, but as long as you and I can work on the minutes offline, so I can get that to the schools without a further delay, I'd be fine with that.
Excellent. I'll let the other folks have the pleasure of the.
Wait, Mark, before you go on, while we're on the subject of meetings, is there something with Acton Water tomorrow?
I believe that they have a meeting of the commissioners tomorrow.
Okay. This isn't a joint meeting with health, is it?
No.
Okay. All right.
It's with arsenic on the agenda. It'll be a big meeting in attendance, probably.
Okay. Then with that resolved, I will move to adjourn.
Very good. Is there a second?
Second.
Thank you. We have a motion made and seconded to adjourn. We can do this, I believe, by voice vote. All those in favor, please say aye.
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 I also vote aye. We are adjourned. Thank you all again. You all are just wonderful to keep supporting the town and on our accelerated schedule and getting through these rather difficult issues. So we've had to make a lot of judgments, and I think we've come up with very fair and equitable approaches to everything we've tackled in the last few weeks. So thank you all.
All right. Good night.
Thank you.
All right. Good night.
Bye.
Good night.